Let's say that you're trying to predict someone's risk of heart disease, and your healthcare system or research funder is only going to let you include a couple of questions to make this prediction. Are you better off asking about someone's social status, like their income or occupation? Or should you check a quick saliva sample to look at their genetic risk factors? My name is Rita Hamad, and I'm an associate professor at the University of California, San Francisco. I'd like to tell you a little bit today about our team's latest paper that's being published in the journal Epidemiology that gets at this question. The title is Explaining the Variance in Cardiovascular Disease Risk Factors, a comparison of demographic, socioeconomic, and genetic predictors. To give a little background, there's a lot of interest these days in precision medicine, and specifically trying to use an individual's genetic markers to predict their heart disease risk. At the same time, there's increasing acknowledgement that social factors like wealth and education are important predictors. While a lot of studies try to understand the relationships between socioeconomic or genetic characteristics and heart disease separately, our study is among the first to try to compare the predictive value of socioeconomic and genetic characteristics. We use data on over 8,000 white and Black individuals in the US Health and Retirement Study. The health outcomes we examined were self-reported heart disease, diabetes, depression, smoking, and body mass index, and objectively measured total and high-density lipoprotein cholesterol. For each outcome, we examined how much of the variance was explained by socioeconomic position, how much was explained by genetic characteristics, and how much was explained by basic demographics. Socioeconomic position was captured by education, assets, income, occupational status, neighborhood socioeconomic characteristics, and childhood socioeconomic position. Genetic characteristics included a polygenic risk score specific to each outcome and principal components for genetic ancestry. Demographic characteristics included gender, birth year, and region of residence. Our results can be boiled down to four main conclusions. First, this very long list of predictors didn't explain a huge amount of the variance for these outcomes. The adjusted R-squared ranged from 3.7 to 14.3% depending on the outcome. So there's a lot of random variation in these outcomes or other unobserved predictors. Second, basic demographic characteristics explained more than half this variance for most outcomes. Third, socioeconomic position explained comparable or greater variance relative to the genetic characteristics for most outcomes. Fourth, the predictive value of genetic characteristics was lower among Black participants compared with white participants. This is not surprising, and it's because existing genetic research is conducted in mostly white samples, which is hugely problematic. It limits the ability of studies like ours to use genetic risk scores in other groups like Black people. So to sum it up, if you could only add one set of variables to your data set to better predict someone's heart disease risk, it should be their age, gender, and where they live. If you can sneak in a couple more, you're best off asking about their social risk factors. Sorry, precision medicine. Better luck next time.